Now the topic is chronic rhinitis. So this is a sequel of acute rhinitis which progresses to be a chronic one. Okay, we will see the details of this disease in the course of the slides. Okay, chronic rhinitis results from long-standing acute rhinitis. If the infection or inflammation is not controlled properly, or if it is left untreated for a long time, then it becomes to be chronic rhinitis. Okay, now we will see the etiology or the causative factors. So what are the etiologies? These are chronic diseases of nose and sinuses, infective focus or foci around the nasal cavity, iatrogenic, that means misuse of nasal drops, etc. Professional and environmental causes, dusts, harmful chemical or gas, physical changes, etc. So these include a wide range of components which are ranging from particulate matter to harmful chemical gases. Okay, also it includes some clinical diseases of nose and the nasal cavity and the paranasal sinuses. Okay, so all these things as well as professional hazards can cause acute rhinitis, which may progress into a chronic rhinitis, which is a chronic condition of the nasal cavity. Okay. Types of chronic rhinitis. Number one is simple rhinitis. Number two is hypertrophic rhinitis. Obviously, in simple rhinitis, there is no hypertrophy or hyperplasia. Okay, so that means there is no proliferation of the cells or no increase in size of the cells. Okay. Next one is the hypertrophic chronic rhinitis. So as the name suggests, there is hypertrophy. Hypertrophy of which part? Hypertrophy of nasal mucosa, submucosa, even periosteum and os present with limited or extensive hypertrophy. So depending upon the degree of the disease, the hypertrophy can be limited or extensive. Okay, and hypertrophy of which region? Hypertrophy of the nasal mucosa, submucosa, periosteum and os. So among these, the periosteum and os hypertrophy are optional, whereas the nasal mucosa and submucosa hypertrophy are essential, okay, to call it a chronic hypertrophic rhinitis. Okay. Now we will see the signs and symptoms of the clinical manifestations of the chronic rhinitis. These are nasal obstruction. Obviously, if there is rhinitis, there will be inflamed mucosa and submucosa, which would lead to the obstruction of the nasal pathway. Rhinorrhea or running nose, that means the discharge coming out from the nose. Next is hypertrophic inferior meatus. So in case of the hypertrophic chronic rhinitis, the inferior meatus will be hypertrophied. Hypersecretion of mucus. This is just the another way of describing rhinorrhea. Okay. Next is watery eyes, itchy throat. Okay, so these two are extranasal symptoms associated with chronic hypertrophic or chronic rhinitis. Okay, next is swollen and reddened nose. So since there is inflammation, there would be swelling and there would be redness. Nasal congestion, anosmia. Since there is hypersecretion of mucus and the obstruction of the nasal pathway, that is why there would be compromised olfaction or compromised sense of smelling. So that is called anosmia. So there will be anosmia, or the patient will not be able to smell something. Okay, and next is flu-like symptom. If there is any kind of inflammation, that might lead to flu-like symptoms. Okay, so here also this chronic rhinitis can lead to development of flu-like symptoms. Okay, like feverish feeling, etc., weakness, etc. So in allergic among the allergic symptoms, watery eyes, running nose, and itchy throat. So these two together, these are grouped as allergic symptoms, and these might be caused by pollens, dust mite, debris, and or animal dander. That means animal fur or any any fiber or any particulate matter generated from any animal. These are called as danders. Okay, so these trigger factor can lead to the generation of these allergic symptoms like watery eyes, running nose, and itchy throat. Next is treatment. The mainstay of treatment is based on the pathogenic organism. Okay, and local treatment might be used. So in case of simple rhinitis or simple chronic rhinitis, we use vasoconstrictor and sympathomimetic drugs. And in case of hypertrophic chronic rhinitis, we use vasoconstrictor and sympathomimetics. Along with that, we use electrocoagulation, laser, microwave, radiofrequency, partial inferior turbinectomy in case of resistant chronic rhinitis. So in case of resistant chronic rhinitis, when it is not responding to the classical therapeutic drugs, then we might have to go for surgical ways. So what is the surgical ways? So these are partial inferior turbinectomy or the removal of the turbinates, inferior turbinates. Okay. Next is allergic rhinitis. This is the same rhinitis, but the cause behind the rhinitis is allergic. Okay. So this is related to hypersensitivity. Basically, these are of two types. Number one is seasonal allergic rhinitis and number two is perennial allergic rhinitis. So in case of seasonal allergic rhinitis, this disease is precipitate when a particular season comes, and in perennial rhinitis, the frequency or the episodes of rhinitis remains constant throughout the year. So there is no seasonal variation in case of perennial allergic rhinitis. So in case of seasonal allergic rhinitis, this is also called hay fever. This is caused by seasonal allergens like pollens, certain flowers, weeds, grass, etc. Which in case of seasonal allergic rhinitis, the triggering allergens are based on or are related to some particular season. So one particular flower will be blossoming in a particular season, or any other flower would be blooming in some suppose in spring, or some flower will bloom in winter. So accordingly, the allergic rhinitis will be precipitated in that particular or that respective season. Okay. Next is in perennial allergic rhinitis. This one is caused by non-seasonal allergens like dust mites, animal dander, mold, etc., which the presence is constant throughout the year. So there is no seasonal variation in the frequency and intensity of this particular disease, which is non-seasonal allergic rhinitis or perennial allergic rhinitis. Now we will see the signs and symptoms. Among the signs and symptoms, sneezing is the most common symptom. Okay, so we can a person who is having allergic rhinitis will keep on sneezing frequently. Okay, itching in nose. So not exactly the classical or the what we know as normal conventional itching. So, but there would be a there would be a kind of itching or kind of irritating sensation inside the nose. You'll feel like something is coming out from your nose. You'll try to remove that, but you'll see actually there is nothing coming, but there is a sensation of itching or sensation of something coming out of your nose in the case of allergic rhinitis. So this is a sensation. Basically, an irritating sensation of the nose would be there. A local irritation of the nose would be there. Next is rhinorrhea or discharge from the nose, nasal congestion, itching in the eyes, throat, ears. So this itching in the eyes, throat and ears is a classical allergic symptom. So whenever there is an allergy or whenever there is a local allergy in the face region, so that would be accompanied by itching in the eyes, throat and ears. Okay. Next is systemic effects like fatigue, sleepiness, etc. So there would be systemic effects like fatigue, sleepiness, etc. So why the weakness or fatigue occurs? Because the histamine, which is related, classically related with allergy, is a potent vasodilator. So histamine would cause the allergy, and subsequently it would also cause vasodilation. So because of the vasodilation, the patient will be feeling, the blood pressure of the patient would go low. So due to the hypotension, the patient would feel weak and fatigued, okay, and he would feel sleepy. So the cause of fatigue in case of allergic rhinitis is basically vasodilation, which is caused by the histamine, which is triggering the allergy itself. Next is the physical changes or physical signs what we can see with our bare eyes. Okay, so these are the body or the peripheral turbinates or becomes pale blue or edematous. Turbinates, clear and watery nasal discharge, crease from the nasal salute. So we have seen that the roof of the nose is elevated. Okay, so there would be crease. Why crease? Because of the frequent discharge from the nose, the patient would be wiping out, or patient will be pulling the nose to control the discharge flow. Okay, so because of these actions, there would be a crease formation on the external roof side of the nose. Okay, so this is known as the crease or fold. Treatment: based on the presenting signs and symptoms, different medications are advised to the patient. Avoiding the triggering allergen is by far the best preventive measure. So whenever we can identify the allergen, the triggering allergen, it is the best to avoid that allergen to get rid of this allergic rhinitis. Okay, so that is the best preventive measure. Next is, there are many pharmacotherapeutic options for treating allergic rhinitis. So for the treatment purpose of this allergic rhinitis, there are many drugs which act on different principles that can be administered to control this allergic rhinitis. So we will see the options one by one. Number one is antihistaminic. This is the classical anti-allergic. So this antihistaminic relieves from the symptom sneezing, rhinorrhea or discharge from the nose, and conjunctivitis. Okay. So remarks. This is the first line for seasonal allergic rhinitis. If sedation is causing problem, switch to non-sedative options like the newer generation of antihistaminics. So we know that the first generation antihistaminics are sedative in nature, but the newer antihistaminics or the second generation antihistaminics are non-sedative in nature. So if the patient is facing problem due to the sedative effect of the first generation antihistaminics, then we have to switch to the newer antihistaminics. Newer antihistaminics like levocetirizine, etc. Okay, and the older antihistaminics are propafenazole, etc. Okay, so if the patient is facing problem with this sedative effect of the first generation antihistaminics, we can switch to the newer antihistaminic. Otherwise, if the patient is having no such problem in sedation, then the first generation antihistaminics are actually preferred, because if the patient sleeps, then he or she will be relieved and the recovery will be faster. And if suppose the patient has exam next day, so in those cases we use non-sedative antihistaminics. Okay, the next is for perennial allergic rhinitis. Perennial means there would be no seasonal variation. Used as an alternative or in combination with intranasal steroids. So, in case of the perennial allergic rhinitis, the antihistaminics are used in combination with intranasal steroid. So, intranasal steroid would take care of the inflammation which is there in the rhinitis, and the antihistaminic would take care of the allergic hypersensitivity type of reaction. Okay, so together antihistaminic and intranasal steroid would be sufficient to limit this condition. Okay, next is ophthalmic or intranasal drugs. So these are drops actually. These are responsible for relieving from the ocular symptoms. Ocular symptoms means irritation in the eye, especially in the conjunctiva part, and like watery eye or watery discharge from the eye. So these would take care of these symptoms. Next is decongestant. These decongestants take care of the nasal congestion. Next one is must take intranasal corticosteroid. These ICS take care of these intranasal corticosteroids take care of sneezing, rhinorrhea, itching, and nasal congestion. And these are excellent options for perennial rhinitis. So in case of perennial allergic rhinitis, which is independent of the seasonal variation, we can use intranasal corticosteroid. Next is mast cell stabilizer like Montelukast, etc. These are responsible for alleviating the symptoms of seasonal allergic rhinitis. Use before, so we have to use before the allergens season. Improvement within 1 month to approximately a few months. So in case of seasonal allergic rhinitis, if we use mast cell stabilizer like Montelukast, we have to use this drug before the onset of the symptoms or before the onset of the presenting season. Suppose a patient usually has the allergic rhinitis in monsoon. So before 1 month of the onset of the monsoon, the Montelukast therapy would be started. Okay, so the patient will so when the monsoon hits, the patient will not be having these symptoms, or the symptoms would subside within 1 month to few months. The next is intranasal anticholinergics. So these drugs help to reduce the rhinorrhea or the nasal discharge, since anticholinergics are anti-secretory drugs. So whenever we use anticholinergic drugs, all the secretion of the body stops. So intranasal anticholinergic drops would take care of the rhinorrhea or of the nasal discharge. So this table we have to remember. Next is epistaxis. Epistaxis is nasal bleeding or nose bleeding. Nasal hemorrhage, nosebleed, bloody nose. So there are some factors, of which climate factor is the prime one. Here most common, the epistaxis or nasal bleeding is most common in dry and cold climate. Okay, not in humid climate. Okay. Next is the primary bleeding site is anterior is common and posterior is rare. Most common bleeding site is Little's area, where there is Kesselbach's plexus. The causes are local or generated from trauma, fracture of the nasal bone, infection via infection or acute rhinitis, nasal septum deviation, atmospheric change, tumors in nasal cavity and sinuses, and foreign bodies. So these are the factors which lead to the development of this epistaxis or nasal hemorrhage. Next is general. There are some general causes which include hypertension and heart diseases, acute epidemic diseases, hematological diseases, nutritional deficiencies like vitamin C, vitamin K, vitamin P and calcium, etc. Liver and kidney related diseases and rheumatic fever. So these are the general causes which can cause or which can result into the development of epistaxis. Next is treatment. Number one is sedation. As I mentioned earlier that the sedation sometimes is necessary for the healing of the patient or for the fast recovery of the patient. So complete rest by sedation, posture correction. So if the patient is placed with the head held high, the chance of bleeding would reduce. Hemostasis. Hemostasis means stasis of the blood or stoppage of the blood. Next is cautery. Cautery is similar to electrocoagulation. Okay. Next is nasal packing. So there is a tissue or cotton or gauze is plugged into the nostril or nasal cavity so that the bleeding stops. Next is artery ligation. The artery from which the bleeding is coming out, that artery is ligated or knotted. Okay, so angiography to check the embolization, whether there is any embolization or not, which is actually causing the bleeding. Next is vitamin C, vitamin K supplementation. Next one is calcium supplementation, which prevents the capillary fragility. And number 10 is the anti-shock measures. Why? Because if there is excessive bleeding, the patient might be going to hypovolemic shock. Okay, hypovolemic shock or anemic shock. So in that case, we have to take care of the patient so that he or she does not undergo shock. That means the blood volume should be maintained. See, this is the little area for epistaxis from Kisselbach's plexus. So this is the Kisselbach's plexus. Okay. This is the Little's area. And this is the Kisselbach's plexus. Next is endoscopic sinus surgery or ESS. So whenever there is delicate surgery inside the nasal cavity, we always choose endoscopic sinus surgery to minimize the extent of damage and to minimize the extent of incision. Okay, so we use endoscopic sinus surgery. So in case of endoscopic sinus surgery, there is a probe which is equipped with an optical fiber along with a camera attached with it. So whenever it is inserted into the nasal cavity, we can view the nasal cavity in the monitor. So this is how the endoscopic surgery goes on. Indications for ESS or endoscopic sinus surgery. Chronic bacterial sinusitis non-responsive to medical treatment, recurrent acute bacterial sinusitis and polypoid rhinosinusitis, fungal sinusitis, anthracoanal polyp, mucocele, ethmoid or sphenoid sinuses, foreign bodies in the nose, endoscopic septoplasty. So these are the process these are the conditions for which we normally do endoscopic sinus surgery. So this is a picture of endoscopic sinus surgery. Please remember this picture as it might come in the MCQ as what is this process or procedure of this surgery. So we will have to choose accordingly. So this is also endoscopic sinus surgery.